Okay, guys. So today we are going to start Nux Moschata. Okay, Nux Moschata is really famous remedy in a female. Okay, this is rarely used in males, mostly used in females. So basically, it is a nutmeg. Okay, it is prepared with the nutmeg. There is a marked tendency to fainting fits with heart failure. There is marked tendency to fainting fits. There is fainting fits with heart failure, with cold extremities, and extreme dryness of mucous membrane. Basically, if you are going to learn this remedy, you will understand. Patient is so thirsty, patient is so dry that tongue is almost there to the palate, but still patient don't feel to have any water. Okay, there is so much of thirstless is there. You will get in this remedy. There is marked tendency to fainting fits. There are fainting fits, but this is reality. Okay, this is in a real fainting fit. It's not like Moscow's. There is hysterical fits. Here, fainting fits. Patient actually have that fainting fits with heart failure, cold extremities, extreme dryness of mucous membrane and skin. There is strange feeling with irresistible drowsiness. There is strange feeling and patient have continuous drowsiness. Patient really want to sleep, but there is continuous drowsiness. Okay, there is indicaria and general inclination to become unconscious during acute attack. Okay, so during acute attack, patient has that tendency to get unconsciousness. Okay, patient can suddenly fall off. Okay, patient can suddenly get that unconsciousness, and patient can really get that fit, and patient will fall down. Um, and generally this happen whenever any acute disease is there. There is again this remedy is again used for uh, liptomia. Okay, now what do you mean by that? Anyone know about it? Hello guys, anyone know about it? It means syncope. Okay, syncope means transient loss of consciousness. Okay, patient really don't understand anything. Syncope or vertigo, such type of things comes under liptomia. Okay, basically it is known as syncope. Again, this ignitia is again a remedy for a syncope. There is staggers on trying to walk. This patient really cannot walk properly. Okay, gait has been become difficult, and patient cannot walk properly. Mind, there is changeable laughing and changeability in mind. You will get such changeability or contradictory things in ignitia also. Okay, continuous changeableness. At one moment patient will laugh, another moment patient will suddenly start with crying. Okay, so such continuous changeability you will also get in Nux Moschata. There is confused state of mind, impaired memory. Patient is really have impaired memory. Patient really sometimes patient can't understand the things which had happened recently. Okay, vivid senses as in a dream, think she has a two heads. Now this symptom thinks she has a two heads. Again you are going to get this symptom in your anacardium orientale. Okay, anacardium also have two wheels. One is angel, another one is devil, and one is telling him to do good things, another is telling him to do bad things. Such two heads or such two thought processes you are going to get in anacardium. Here in a small chata also you are going to get this similar things. Okay, here there is vertigo when walking in open air, aches from eating a little too much. Patient will really eat something little too much, and patient will start sudden headache, feeling of expansion with sleepiness. Okay, as I told you in earlier, there is continuous drowsiness and patient feel that hair has been expanded. Okay, feeling of expansion with sleepiness, patient really want to sleep. Pulsating in head, continuous pulsation feel in the head, especially in a temporal region. Okay, a temporal artery is going on. You can understand that pulsating in head. A cracking sensation in head, sensitive to slightest touch in draft of air. A slight touch and draft of air will really aggravate the condition. Again, for draft of air, there are remedies like silicia, great remedy. Draft of air aggravates the complaint. This remedy is really great. Hepar Cilicia. This remedy really helps a lot. Bursting headache, better by heart pressure. Okay, there is lot of bursting headache which get relieved by heart pressure. Eyes objects look larger, very distant or vanish. Okay, if you are going to look something, you will feel that is really very larger. Okay, or very distant or vanish. It gets vanish very easily. There is moles before eyes and mydriasis. Again, this remedy is great remedy for mydriasis. And there is in nose there is oversensitiveness toward the smell. Patient will really understand the smell very easily. Nosebleed, dark blood, dry and stopped up. Okay, dark red blood, dark blood you will get during epistaxis, and dryness of a nose with stopped up feeling. Okay, as if nose has been choked up. Okay, coryza has not been thrown away. Okay, such feeling is there. There is stopped up feeling. Mouth, it is very dry. Tongue adheres to a roof of mouth, but no desire for water. Saliva like cotton, cotton like saliva. Again, remedy is berberis. Now, cotton like feeling in a throat, remedy is your drosera. Okay. Toothache in pregnancy, tongue is numb and paralyzed, dryness of throat, stomach, excessively bloated stomach, flatulent dyspepsia, hiccups and craving for highly seasoned food. These people really have that dryness of throat, as I told you, numb and paralyzed tongue with hiccups and with lot of toothache especially during pregnancy. Okay, there is excessively bloated feeling in the stomach, flatulent dyspepsia is there, hiccups and craving for highly seasoned food. These people really like seasoned food. These people really love spicy food. Okay, सीझन फूड म्हणजे मसालेदार पदार्थ, खूप मसालेदार पदार्थ या लोकांना आवडतात. ओके, retrosion of gout to stomach. Okay, it means complaints of gout will start after stomach complaint get over. Okay, abdomen, paralytic weakness of intestine, enormously distended. You will really get that distension of abdomen. Stool is really soft, yet is unable to expel it. Okay, just like your alumina. Soft stool, yet patient need to pass it very vigorously. Okay, even with long straining, just like your alumina. As I telling you, alumina is again a remedy for your long straining. Require a lot of straining in a soft stool. Okay, there is faintness during or after stool and protruding piles. Okay, again this remedy is really great remedy for a piles, but faintness. Okay, there is syncope, or whenever you are going to get any syncope or fainting and fainting spells and fits, you can think about this remedy and Nux Moschata. I also need to think about this remedy in my one patient. Female uterine hemorrhages means too long, dark, thick, leukorrhea, muddy and bloody, separations with persistent fainting attack and sleepiness, just like your Kalika. Variableness of menstruation, irregularity of time and quantity. Respiratory, loss of voice from walking against the wind, just like your hipper. Okay, whenever you are going to walk against the wind, the draft of wind is going to directly thrust on your face. Okay, it is directly you are going to directly face that draft of air, which leads to laryngitis or pharyngitis like problem, which leads to loss of voice. Okay, again cough when getting warm in bed. Heart, a heart complaint, there is trembling, fluttering sensation as if something has been something grasped heart, just like your cactus. Cactus is again a remedy, cactus grandiflorus, again a remedy for your heart complaint. You can use that mother tincture as a heart tonic, or as a what you can say, a substitute towards the aspirin, substitute to aspirin. You can use that remedy for your heart patient. There is palpitation, pulse are intermittent. Extremities, pain in right hip to knee, pain in right hip to knee, worse by motion, especially going upstairs. Rheumatism from getting feet wet from exposure to drafts. Rheumatism relieved by dry, warm cloth. fatigue on slightest exertion. There is pain in right hip to knee. Right leg has been affected. It gets worse by motion, especially going upstairs. Upstairs, this Nux Moschata, if I am not wrong, I am not sure about Badiaga, but please read about Badiaga. I think downstairs knee pain in back of knee, Badiaga is the remedy. Okay, it's your homework that you are going to read about Badiaga and you are going to tell me about it. Rheumatism from getting feet wet, from exposure to drafts, rheumatism relieved by dry, warm clothes, fatigue on slightest exertion, sleep, there is great drowsiness, complaints cause sleepiness. Okay. Again, if you can think about the symptomatology, you can use this remedy palliative treatment in hypothyroidism. But if you need to treat hypothyroidism completely, you have to think about iodine. Then where you can think about thyroidinum. Okay, so if you need to treat a case palliative purpose in a palliative manner, you have to think about such remedies. Fever, there is chill begin in left hand, just like your carbo animalis or carbovage. Sorry, it's carbovage. Chilliness and heat without thirst. There is no thirst. This remedy is completely thirstless remedy. They want a perspiration, a dry skin in inner parts, also eyes, nose, lips, mouth, tongue, throat, everything has been dry. Modalities, it gets worse in cold, moist wind, cold food, cold washing, lying on painful side. As you have seen, modalities, everything is get worse by cold. Okay, these patients are really very chilly. It again get worse by painful side, motion, jar, and it get better by warmth, dry weather. Okay, so this is all about your Nux Moschata. You want me to take a next remedy in same lecture, or you want me to revise it? Hello guys, please reply fast. Be unmute. Hello.
मैम नेक्स्ट रेमेडी है.
Okay. So next remedy we are going to start with Croton tick. Okay, Croton tick basically it is called as मराठी मधून सांगायचं झालं तर जमाल गोटा. Okay, you use this remedy as a purgative. You use this remedy as a purgative so that patient will pass stool very properly. Okay, it leads to a diarrhea. So croton tea is a croton oil seed. It is a valuable remedy in diarrhea. You can use this remedy in diarrhea, especially summer complaints and skin affections. I have never used this remedy in skin affections. I have used medorinum or meserium and basilinum and tellurium like remedy in skin affections. But croton tea again a very great remedy for skin affections. Okay, these may alternate with each other. Diarrhea can alternate with skin complaints. Okay, feels tight all over. Okay, feels tight all over. It is one of the antidote to rust poisoning and is evident from a wide and intense action upon the skin mucous surface, causing both irritation and inflammation with formications with formation of vesicles and mucus discharges. This is really important line. Okay, this is one of the important antidote towards the rust poisoning. Now if you are going to think about, or if you are going to learn about rust tox, if you are going to read about rust tox, you will get everything, redness of a skin and itching and everything. Okay, just like so whenever you are going to give rust tox in a high dosage or in a sensitive patient, and if patient started with proving of rust tox, it will lead to complaints like redness of a skin and itching and everything, okay, swelling. At that time, to antidote it, you can use Croton. Again, if you are going to use Apis, okay, Apis mellifica, if you are going to use Apis mellifica, after that you cannot use Rustox. Why? Because Apis mellifica is prepared with honeybee and Rustox is a poisonous plant, okay. If you are going to use those remedy, they will cut out their actions, cut out each and another's actions, okay. So it will lead to a problem to patient. So some remedies are like you cannot use one after another, which you call as an inimical remedy. In same way, after Rustox, if Rustox is not working or if Rustox leads to problems, then you can antidote it with Croton. Okay, and it has a wide and intense action, okay. It has a wide and intense action, especially upon the skin and mucous surface. It causes both irritation and inflammation. It leads to irritation as well as inflammation with formation of vesicles and mucus discharges, okay. So again, there is vesicle formation, vesicles, bullae. I think I had teached you in second year only, okay. Vesicles formation, a uh, small tiny dots has been formed, which has a discharges, water discharges, mucus discharges has been passes through it, okay. Such formation of vesicles due to inflammation and irritation on the skin, you will get such type of symptomatology. Here you can again think about your graphitis. Graphitis is again remedy for such type of pathology. Has elective affinity for skin, face, and external genital, burning in the esophagus. Now, again, this is the remedy for burning in the esophagus. Head, pressing pain in forehead, especially orbit. Okay, pressing pain in forehead, especially orbits. Eyes, glandular lids, pustules of a cornea, a red and raw appearance. Okay, granular lids, granulation in the lids, pustules of cornea. Again, this is the remedy for pustules of cornea. Red and raw appearance, feel drawn backward. Okay, red appearance, redness of the lid. Okay, and redness of the eyes, rawness of the eyes, feels drawn backward, as if something has been drawn backward. Feeling, such type of feeling in the eyes. Okay, eruptions around the eyes, tensive pain above right orbit. There is lot of tensive pain, as if tension has been there in a right orbit. Such type of tensive or swelling, as if swelling has been come up, okay. Such type of pain you will get in these things, okay. Then right orbit, just about the right orbit. Stools, copious watery stool. This is the great remedy for your diarrhea, as I told you. Again, Veratrum herbum, Croton. These are the really remedy for your diarrhea, okay. And there is copious watery stool with much urging. Always forcibly shoot out with gurgling in intestine. Worse by drinking least quantity or even while eating. Constant urging to stool followed by sudden evacuation, swashing sensation in the intestine. Now try to understand it, okay? There is copious stool with urging, with gurgling in intestine. So if this patient is in a toilet, you will understand by appearance that this patient we should prescribe him Croton. Okay, so much of loudy things are there, okay. It get worse if this patient is try to eat something, if this patient is try to have something, something which he can drink, a least quantity can again lead a lot of urging, and just after urging, patient will sudden evacuate the thing, okay. So again, sudden evacuation you are going to get in these things. There is fashion sensation, as if everything has been thrown away, okay. Swashing sensation, everything has been thrown away from the intestine. So such feelings are there in this remedy. Then urine, there is night urine foaming. Night urine foaming, you will get foam on the urine, a dark orange color, a dark orange color, turbid on standing. A dark orange color urine which get turbid on standing. So proteinuria, you can think about the proteinuria. There is greasy particles which floats on the top, floating on the top. Day urine is pale with white sediments, okay. So night urine and day urine both are different, okay. Night There is foaming, there is dark orange red color, turbid standing, greasy particles on floating on top, and daytime it will be pale. It will be pale with white sediments. Chest, there is drawing pain through the left chest into the back. Okay, there is lot of pain through the left chest into back. Asthma with cough cannot expand the chest. Patient really cannot expand the chest with lot of cough. Okay, and asthmatic feeling. Nursing woman, every suck of the child will give produce a pain from nipple to back. Okay, in nursing woman, the patient who gives the breastfeed to her children, it will lead to a pain. Every suck will lead to a pain from nipple to back. Cough as soon as he touches the pillow must get up, just like your lycopodium. Okay, lying down aggravates the complaints. A patient will started with coughing as soon as he touch the pillow, and patient really need to get up. There is sensitive to deep breathing. This patient really gets sensitive to deep breathing. Skin, he feels hide-bound, intense itching, but scratching is painful. Patient cannot scratch. Okay, postular eruption, especially on face and genital, with fearful itching, followed by painful burning vesicles, confluent oozing, vesicular erysipelas, itching extendingly, and herpes zoster, stinging, smarting pain of the eruptions. Basically, you can think about this remedy in your diarrhea like complaints, and skin complaints are more important. Okay, we have seen two remedies today. First one is Nux Moschata, and second one is your Croton. Any query in these two remedies? Hello guys, any query in these two remedies? No, ma'am. Okay, should we repeat all the things? Hello, can we repeat all the things?
Yes, ma'am.
Okay, okay. We will repeat both the remedies today. Okay, we will repeat first of all Croton. Croton is a, as I told you, it's a Jamal Gota basically. Okay, you use this remedy for a diarrhea. Okay, basically this is valuable remedy in diarrhea, especially in a summer complaints and skin affection. There is lot of skin affections and diarrhea, and this can alternate with each other. When skin affection started, diarrhea will stop. When diarrhea will start, skin affection will be go down. It There is a feeling, continuous feeling of tightness all over. It is one of the antidote to rust poisoning. This is again a remedy for antidote towards the rust poisoning, as is evident from its wide and intense action upon skin and mucous surface. It causing both irritation and inflammation with formation of vesicles and mucous discharges. As I told you, you can use antidote to rust tox. This remedy, you can use Crotontic as an antidotal remedy to rust tox, because it has a capacity to contain or to it has that evident, and it has that intense action. Okay, it has capacity to handle that rust poisoning. Okay, it leads to a lot of irritation and inflammation of the skin, which lead to formation of vesicles and mucus discharges, and all these complaints you are going to get in this remedy. Again, it has selective affinity of skin, face, external genitals, burning in the esophagus. Then head, there is pressing pain in forehead, especially in orbits, glandular leads, pustules of cornea, red and raw appearance, feel drawn backward, eruption around the eyes, and tensive pain about the right orbit. What happened? In granular leads, there is granular leads, there is redness and rawness of the eye, and feel drawn backward, as if eyeball has been feel drawn backward, and eruptions around the eye, and there is tensive pain on the right, above the right orbit. Okay, stool, as I told you, this is really important remedy for a stool complaints and skin complaints. There is copious watery stool with much urging, lot of urging is there, and copious watery stool, it always forcibly shoot out with gurgling in intestine. A lot of, as I told you, if you are going to if you need to understand this is Croton patient or not, you just need to go just to the toilet, and you will understand that patient, there is lot of loudness, okay, there is lot of sound you will get in these patients, okay. So diarrhea has been forcefully thrown away, okay. So such type of copious thing you are going to get. Copious, basically copious means profuse, okay. So you will get such type of profuse stools, okay. Patient really cannot eat anything, and patient really cannot drink anything. A least quantity of eating or drinking will lead to a diarrhea, okay. There is constant urging, constant patient is feel that urge to pass a stool, which followed by sudden evacuation, which followed by sudden passing out the stool, and which leads to a swashing sensation in the intestine, okay. There is a lot of swashing sensation, means as if everything has been suddenly thrown away, okay, and it has been emptied suddenly. Urine, there is night urine foaming. Night urine and day urine, these are the base different time of urine, where night urine you are going to get foaming, dark orange red color, turbid on standing, greasy particle on floating on top. And in day urine there is paleness with white sediments. Chest, there is drawing pain through the left chest into back. Asthma with cough, cannot expand the chest. Nursing woman, every suck of a child will produce pain from nipple to back, okay. And there is inflamed breast. Such complaints are there in the nursing ladies. There is cough as soon as patient is try to touch his head to pillow, and he just need to get up, okay. There is sensitiveness towards a deep breathing. Skin, they feel hidebound, intense itching, but scratching is painful. There is lot of itching, but patient really cannot scratch because it leads to a pain. Postular eruptions, there is postular eruptions, means eruption purpose formation you are going to get, especially on face and genital. So you can again use this remedy for postular acne and genitals, where you will get such type of postular eruptions with fearful itching. Patient really have itching, but patient really cannot touch that, patient really cannot scratch it because fear of pain. Followed by painful burning, vesicles, confluent oozing, vesicular erysipelas, itching exceedingly, herpes zoster, stinging, and smarting pains of the eruptions. Modalities, it get worse by least food or drink during summer, touch, night and morning, and washing. Okay, so this is all about your Croton tiglium. Any doubt in Croton? Any doubt in Croton tiglium?
No, ma'am.
No. So I will again revise about your Nux Moschata. We had completed our Nux Moschata. It's a nutmeg. It marked tendency to fainting fits. As we had discussed about moscus and Nux Moschata, Nux Moschata has a fainting fits, and your moscus, it has hysterical fits. Okay, with heart failure. Again, Nux Moschata with heart failure. There is coldness of extremity, extreme dryness of mucous membrane and skin. There is continuous and extreme dryness of mucous membrane and skin. There is strange feeling with irresistible drowsiness. This patient has irresistible drowsiness. This patient continues feel sleepy. There is endoconuria, then general inclination to become unconscious during acute attacks. Okay. Now, if patient have any acute attack, any acute disease, okay, in any acute disease, patient will really goes in a fainting spells, okay. So general inclination, this patient suddenly can lose the consciousness, okay. Then lipothermia, as I told you, it's nothing but a syncope. Again, ignitia is a great remedy for that. Staggers on trying to walk. Patient started with staggering, okay, staggers on trying to walk. Mind, there is changeable laughing and crying, confused, impaired memory. There is bewildered senses as in a dream. Patient really don't understand, is it reality or is it dream. They think she has a two head. As I told you, just like your anacardium, one is angel and one is devil. There is confusedness and impaired memory. This is really a confused personality. Head, there is vertigo on walking in a open air, X from eating, uh, and a little too much, feeling of expansion with sleepiness, pulsating in head, cracking sensation in head, sensitive to slightest touch in a draft of air, bursting headache, better by heart pressure. Then eyes, there is object which look larger, very distant, or vanish, moves before the eyes. And again, this remedy is a great remedy for your mydriasis. And then nose, there is oversensitiveness toward the smell. This patient can have that oversensitiveness toward the smell. There is nosebleed, that is epistaxis, and dark blood which is ooze through the nose. Okay, there is dryness of a nose, and patient feel nose has been stopped up. Mouth is really very dry. Okay, a tongue adheres to the roof of mouth. Okay, but no desire for water. Saliva like Croton, like berberis. Toothache in pregnancy. This patient have really a toothache in a pregnancy. Tongue become numb, paralyzed, dryness of a throat. Stomach excessively bloated, flatulent dyspepsia is there, hiccups and craving for highly seasoned food. This patient have real craving for a highly seasoned food. Okay, then retrocession of gout to stomach. Abdomen, there is paralytic weakness basically of intestine, enormously distended. You will get a distended abdomen. Stools are really very soft, but this patient cannot expel it, yet unable to expel it, even with long straining, just like your alumina. Faintness during or after stool, because this patient really need to strain a lot. Okay, there is protruding piles. Females, uterine hemorrhages, menses too long and dark and thick, leukorrhea muddy and bloody, suppression with persistent fainting attacks and sleepiness, like your calicat, variableness of menstruation, irregularities of time and quantity, respiratory loss of voice from walking against the wind, like your HEPA, a cough when getting from bed, heart trembling, fluttering sensation as if something grasped to the heart. Palpation and pulse are intermittent. Extremities, pain in right hip to knee, worse by motion, especially going upstairs. Rheumatism from getting feet wet from exposure to draft. Rheumatism is relieved by dry, warm clothes, fatigue on slight exertion. As I told you, this is chilly remedy. Okay, this patient cannot tolerate cold in any form. It leads to a cough, it leads to a rheumatism, it leads to extremities pain. Okay, likewise. Sleep, there is a great drowsiness. This patient really want to sleep always. Complaints causes sleepiness and coma. So as I told you, this remedy you can again think in a hypothyroidism. Fever, chill begins in the left hand, like your carbo with chilliness and heat without thirst. Want of perspiration, dry skin of inner part, also of eye, nose, lip, mouth, tongue, and throat, etc. Modalities, it get worse by cold moist wind, cold food, cold washing, lying on painful side, motion, jar, better by warmth and dry weather. So this is all about Nux Moschata. Any query in Nux Moschata? Hello guys, any query in Nux Moschata?
No, ma'am.
Okay.
No, ma'am.
Can we stop here? Can we stop here?
Yes, ma'am.
Ah, ma'am.
Oh,
Yes,
oh,
ma'am.
okay, so we will stop over here.
Yes.
We will stop over here. Tomorrow I'll take another remedy, and after completing our portion, we are going to revise each and every remedy.
Okay, ma'am.